that we must give health care to every Ugandan. There must be equity. When you talk about outreach of this hospital, you want to have branches in every district, every region, and that kind of thing. That is provided for in the NDP4, and we'll be grateful to have the healing way, even in Bukedia. I am one of the proprietors in the health sector. I was telling him that my hospital sees more patients than a regional referral hospital, and we do more operations, and we are doing very well.
Wetwogerera nga Paalamenti ya Uganda eri mu kafo okuddabula ebbaga erikwata ku nsuwa y'ebyobulamu erimanyiddwa nga National Health Insurance Bill ng'ebbago lino singa liyisibwa guno si gwe gugenda okubeera omulundi ogusoose nga kinajjukirwa nti lino lyayisibwako kyokka ne lisazibwamu nga wayisa akaseera katono oluvannyuma lw'okusangibwamu ebirumira mu mwaka ogwa 2021. Emu ku biri mu bbago lino kwe kubeera nga abantu abakulu beetaaga okusasulira abaana abato akasente mu ngeri ya yinsuwa buli mwaka kibayamba okufuna obujjanjabi ne mu kaseera nga tebalina ssente. Lino siri eryokka eriri mu kubaganyizibwako ebirowoozo nga waliwo n'eriyambako abakyala okuzaala erya Assisted Reproductive Technology Bill ng'omukubiriza w'olukiiko lw'eggwanga Nnaalongo Annete ng'ategeezezza nti amabago gano galina okuyisibwa mu kaseera ng'ekisanja kye balimu tekinnaggwako ku lw'obulamu bwa bannayuganda.
I talked about the National Insurance Bill. Dr. Yumi, as we live here, I want you to make a follow-up on 2 bills. And those bills must be passed before we leave this term. I want you to make a follow-up on the National Insurance Bill, make a follow-up on the Assisted Reproductive Technology Bill, that had the first reading.
Ono okwogera bino asinzidde mu kugulawo eddwaliro erimanyiddwa nga Healing Way erisangibwa Bugolobi nga ino lyazimbiddwa Captain Mike Mukula era ng'asiimye abantu ssekinnoomu abavaayo okukwasiza ku gavumenti mu nsonga z'ebyobulamu. Captain Mike Mukula asinzidde wano n'asaba Sipiika Mongo obutaddiriza ku nsonga y'okugoba ebbago lya yinsuwa ey'ebyobulamu.
This is fundamental because Kenya has it, Tanzania has it, Rwanda has it, Uganda has about the same income per capita ratios. So these are areas, things that we can do as a nation. I think the ball rests on you, and I urge you with uttermost humility, Right Honourable Speaker, that we would be exceedingly humbled as the private sector participants in the private sector care to have this health insurance ignited, switched on, so that Ugandans can enjoy adequate and effective health care throughout the country.
Dr. Charles Ayume asinzidde wano n'asaba abakola mu malwaliro obutenyigira mbikolwa ebimenya amateeka ng'emu ku ngeri y'okutumbula ebyobulamu mu ggwanga.
Like if your facility is caught doing unethical issues like harvesting kidneys of children, which in the law, the penalty is death for the individual. But for the private sector, it is 5 billion shillings, not negotiable. So if we slapped 5 billion shillings onto Healing Way, you would close.
Paul Kakande yakusakidde emboozi eno ku Rakes TV Agalero.
I talked about the National Insurance Bill. Dr. Yumi, as we live here, I want you to make a follow-up on 2 bills. And those bills must be passed before we leave this term. I want you to make a follow-up on the National Insurance Bill, make a follow-up on the Assisted Reproductive Technology Bill that had the first reading. It had the first reading in the House, awaiting harmonization with the Minister of Health, and every woman should have the joy of having a kid. You should have that joy. You should not suffer because you cannot be able to produce, but because we don't have a law in place. That should be rectified, because we also don't want our people to do illegal things. So, Honorable Mukula and Professor, we are going to ensure that we have a law in place on reproductive health. Individual to bring an investment like this is a very big achievement for this country, and we want to thank you, Honorable Mike Mukula, our Vice Chairperson of Eastern Region. We want to thank you so much for this investment. You could have put this money somewhere else, but because you feel for people in Uganda, you feel for humanity, you decided to put this money, which you will not recover in 1 year or 5 years or 10 years. It will take time, but this is giving back to community. I want to thank you for that. To the board, I want to challenge the board and management to always translate the amazing outlook of this institution into actual quality of care. I liked what you said, you're going to do assessment, continuous assessment, translate it to quality care that we should be getting from here. With all the investment that has been put here, we should be able to get a return on investment. It may not be in monetary terms, but in terms of how many people feel good about the healing hospital. How many people have been healed here and are preaching the gospel outside there. And as we open this hospital today, I want to ask the ownership of the hospital to continuously look out for what is outside there in terms of innovative health care. What can be brought here to improve better health services? You've talked about the PEP machine equipment. We would be very grateful as Ugandans to have it in this hospital. And I can assure you we will support you towards achieving what you want to achieve. I now want to take the singular honor to officially open the amazing health facility, the Healing Way Hospital. May you live up to your name of healing. Thank you. Captain, I want to thank you for that, for having people at heart. And as you said, we want in a special way to thank the President of the Republic of Uganda, His Excellency Yoweri Kaguta Museveni, for having given the private sector an enabling, conducive environment. The conducive environment for the people of Uganda, for the private sector to be able to invest and complement what government does. We want to thank him so much. And we want to request